Hello and welcome to the very first edition of In the Lab with me, Dr. Kate. Today I'm going to be discussing with you all the art of lip enhancement. All we have to do in today's world is glance at social media and we see thousands of images of girls with beautiful plump lips. But it's super important to stay realistic. Remember, these glamorous selfies have often been filtered, fine-tuned and perfected using numerous apps. I want to make sure my patients' expectations aren't too far from reality and what we can actually achieve. I'm passionate about educating patients on how we can achieve lip balance, symmetry and subtly enhance what they already have. Personally, I'm not a fan of big fake lips, so I always try to go subtle and natural with the results I deliver. When you're choosing a cosmetic injector, it's really important to go to their social media, go to their website, check their credentials and view their before and afters. See if they're the right fit for you and if they can deliver the results you're trying to achieve. Now you're all probably wondering about the cost of these treatments. Low pricing generally means less experienced injectors and an inferior product, which won't last as long and can sometimes appear swollen and lumpy and not deliver the optimal result. My advice, lips are the center point of your face. You really want a result you're going to love. Now to get a little bit more technical. The anatomy of the lips is very complex, but is key to performing the perfect lip enhancement. The vermilion border. This surrounds the lips and gives the lips definition. A sharp vermilion border can frame the lips, and we often use this as a guide when we are applying or overdrawing our lip liner. The Cupid's bow. This is the beautiful curved border of the top lip. Everybody's different. It can be sharp, curved, flat, and it's often different on both sides. Blood vessels. There are two main blood vessels in the lip, and they're both branches of our main facial artery. Everyone is different in where the vessels run and how deep they are, but they generally run along the border of the lip. Muscle. We have one main muscle in our lips, and excuse the big word, but it's called the orbicularis oris muscle. It works to purse the lips and helps us with speech, and it also helps to frame the lips and add shape. The oral commissures. These form the corners of the lips. As we age and lose a bit of volume, they can start to become wider and can often make you look sad or have a downturned smile. The skin around the lip. We call this the cutaneous lip, the coloured portion surrounding the red lip. The skin can show lots of changes as we age, such as vertical lines and wrinkles, volume loss, crepiness and laxity. Lumps and tubercles. These form the body of the lip and give the lips fullness. Sometimes we refer to them as cushions, and they're really plump, full and juicy in younger lips. Now for ratios. It's really important when doing lip enhancements that we keep the ratios of the lip perfect. We often refer to the golden ratio, which is where the top lip is a little bit smaller than the bottom lip, at a ratio of 1 to 1.6. This golden ratio is seen everywhere in nature, in science, in beauty and in art, and delivers the most beautiful result. It's important to assess each lip prior to injecting. There are certain factors that need to be taken into account which are individual for each patient. The age of the patient is the first thing we look at. Are we going to focus on restoring lost volume in an older lip, or to plump and beautify a younger lip? Shape is another important factor. We look for things like asymmetry, the shape of the Cupid's bow, and the definition of the lip. We really want a sharp definition between the red colour of the lip and the surrounding skin, so sometimes we may need to define the vermilion border. We always have to work with the patient's individual anatomy and work with what they've got. What are the proportions of the lips? We always try to maintain the natural proportion, keeping in mind that golden ratio that I explained before of 1 to 1.6. With the top lip being a little bit smaller than the bottom lip. Now remember, we don't always view the lips just from straight on. We need to address the profile view. So looking at the side, you'll see that the top lip should always be a little bit more projected than the bottom, with a straight line from the nose to the chin. What does the skin around the lips look like? In the case of my lovely patient here, we're looking for things like skin quality. Is there any sun damage or signs of collagen loss, such as loose, saggy skin? Are there any fine lines or wrinkles around the mouth, which can sometimes look like little banded lines along the top lip or smoker's lines? I also like to look for things like deep nasolabial folds or smile lines, or marionette folds, which extend from the corner of the lip down to the jawline. She doesn't really have any of these. We also need to look again at those oral commissures like I explained earlier. Are they deep or downturned? If we don't address these things, then the lips themselves can start to look very fake if we just continue to enhance them. We need to make sure all of the features are addressed so everything looks harmonious. Another thing I like to do is look at my patient in animation. That is, when they're laughing, smiling, and talking, because certain things can be disguised when you're just looking at them straight on. For example, do they have a gummy smile? Does their top lip curl under when they laugh? These are things that can be easily treated, but also easily missed. Despite the nitty-gritty of the assessment, the patient goals and desires are of utmost importance. This can help guide my choice in product. For example, do we want a thick, volumizing product to add size and volume to a lip? Or do we want a really soft product to add hydration? This can also guide the number of treatment sessions someone may need and how many mils of filler are required. Remember though, the skills and knowledge and experience of the injector are much more important than the product that's chosen. Following assessment, I always ask myself one question. Will injecting dermal filler into these lips achieve a balanced, natural result? If the answer is yes, then we proceed to treatment. On the day of the procedure, we go through a thorough medical examination and consent process. I won't be going into the ins and outs of that on this video, however. I do ask my patients to avoid any non-medically necessary blood thinners such as fish oil. I also ask them to avoid alcohol, heavy exercise and excess caffeine for at least 2 days before the procedure, as this can cause bruising. I also assess medical history, medications, allergies and previous treatments to make sure that the procedure is safe to perform. Unfortunately, we don't do any dermal filler treatments in patients who have been unwell or have had recent dental work or surgery in the months prior to treatment. Once we've conducted a medical examination, we can then select the product. My preferred products are made of a naturally occurring substance which is found within the skin. The product choice is endless and there are lots of different brands available. We can choose a dermal filler based on the volume we want to achieve, the level of hydration, how soft or firm we want it to feel, how much swelling we want to expect, and also the longevity of the dermal filler. It's important to remember that because we're spoiled for choice, that not all products are created equal. There are some poorer quality products which are often cheaper, but they don't last as long or deliver the best results. Higher quality clinics will always use higher quality products. I'm very strict with hygiene. I make sure that there's no makeup on the face and then we do a thorough cleanse with a special alcohol-based solution to make sure there's no risk of infection. Once we've done a medical consent and selected our product, I then apply a prescription numbing cream to the lips to ensure that the procedure is as comfortable as possible. This stays on for about 10 or 20 minutes. Before we start the treatment, I need to address the risks involved with any cosmetic procedure. Risks involved with lip enhancement can range from mild to much more serious. As a cosmetic doctor, one of my most feared complications is intravascular injection. The lips are very vascular and have a rich blood supply. As with any dermal filler treatment, if the dermal filler is injected directly into an artery or a vein, the filler can actually block the blood vessel or travel to smaller vessels. This is a serious complication and needs to be managed immediately. This is why it is so important to see an experienced practitioner who knows and is experienced in managing these complications. This should be discussed at your consultation and during the consent process, no matter what clinic you go to, and should be done prior to every treatment. As every lip is different, so are the injection techniques. There is no cookie cutter approach to injecting lips. I may start by injecting the vermilion border to add a little bit of definition. I then often move to the body of the lip to add volume. I always like to focus on defining the cupid's bow and filling those soft little pillows to maintain that natural harmony. So we've completed the treatment. Now all that's needed is some aftercare advice. Now remember that the lips are very sensitive, so there may be some side effects as part of the procedure. Always schedule your lip treatment with these in mind. The most common side effect we see is bruising. This is the most common side effect that we see and is possible with any cosmetic injectable. A bruise is just a bruise and in no way will affect the end result. Secondary to bruising is swelling. This is often product dependent and also dependent on the patients. This is super common in lip enhancement and is due to the sensitivity of the area and also due to certain product characteristics in the dermal filler. Swelling generally peaks in the first 48 hours post-treatment and can take a few weeks to settle completely. Asymmetry. A common concern from patients is that their lips appear a little bit lopsided post-treatment. This is either due to an existing asymmetry in the lips that wasn't addressed, or it's just due to swelling. One side might swell more than the other, for example. We always allow this to settle completely before retreating or trying to correct this. Aftercare words of wisdom include avoiding too much heat, such as really hot showers, spas, saunas, and vigorous exercise, as this can contribute to bruising and swelling. The best thing you can do to help protect your lips in this aftercare period is apply a cool compress to them for the first day or two, and avoid any makeup or heavy lipstick in the first 48 hours. Thank you so much for watching our first episode of In the Lab with Dr. Kate on the art of lip enhancement. I hope you found it informative and interesting. If you have any comments, leave them below and don't forget to subscribe to our YouTube channel. Have a wonderful day and we'll see you next time for our next episode of In the Lab with Dr. Kate.